Cushing disease is a rare condition, only affecting 10 to 15 people per million every year. It is more common in women and occurs most often in people between the ages of 20 to 50. A pituitary adenoma is the most common cause of Cushing disease. An adenoma is a pituitary tumor that is almost always benign. The tumors can be hard to diagnose because they are very small. It can also be caused by excessive growth of the pituitary gland. Cushing disease is caused by a benign monoclonal pituitary adenoma that secretes excessive ACTH, which causes supraphysiological secretion of glucocorticoids from the adrenal glands. The excessive circulating cortisol disrupts the normal physiological variation in cortisol levels and exerts negative feedback inhibition on CHR secretion from the hypothalamus. However, the adenoma itself is relatively resistant to the inhibition of endogenous circulating cortisol. Cushing disease is associated with suppressed secretion of CRH and elevated levels of ACTH in relation to the degree of cortisol production. To sum all this up, the pituitary gland releases too much ACTH. ACTH stimulates production and release of cortisol, a stress hormone. Too much ACTH causes the adrenal glands to make too much cortisol. Cortisol is normally released during stressful situations. It also has many other functions, including controlling the body's use of carbohydrates, fats, and proteins, reducing the immune system's response to swelling and inflammation, and regulating blood pressure and the body's water balance. Clinical manifestations of Cushing disease include upper body obesity with thin arms and legs and a round, red, full face, also called moon face. Skin changes that are often seen are acne or skin infections, purple stretch marks called stria on the abdomen, thighs, upper arms, and breast, and thin skin with easy bruising, commonly on the arms and hands. Muscle and bone changes include a backache that occurs with routine activities, bone pain or tenderness, collection of fat between the shoulders, also called a buffalo hump, weakening of the bones, which leads to rib and spine fractures, and weak muscles, causing exercise intolerance. Women may experience excessive hair growth on the face, neck, chest, abdomen, and thighs, and also irregular menstrual cycles. Men may have decreased or no desire for sex and erectile dysfunction. Other symptoms may include mental changes, such as depression, anxiety, or changes in behavior, fatigue, frequent infections, headache, increased thirst and urination, elevated blood pressure, and diabetes. A mnemonic to remember the signs and symptoms of Cushing disease is stressed. S for skin fragile, T for truncal obesity, R for round face and reproductive issues, E, ecchymosis and elevated BP, S, stria on the extremities and abdomen, another S, sugar elevated, E, excessive body hair, or D, dorsocervical fat pad or a buffalo hump, and depression. Diagnosing Cushing disease can be difficult because symptoms can have many different causes and elevated cortisol levels can happen in cycles. Due to this, cortisol levels may not be elevated at the time of testing. 3 tests are commonly ordered to diagnose Cushing disease. Cortisol levels can be measured in urine that has been collected over a 24-hour period. In another test, people with suspected Cushing disease have their cortisol levels measured the morning after taking a late-night dose of dexamethasone. Normally, dexamethasone causes cortisol to drop to a very low level, but in people with Cushing disease, this doesn't happen. The most sensitive test measures cortisol levels in the saliva between 11 p.m. and midnight. A sample of saliva is collected and sent to the lab for analysis. In a healthy person, cortisol levels are very low during this time, but people with Cushing disease have high levels. If the test shows high levels of cortisol, labs to determine the ACTH level in the blood will be ordered. In Cushing disease, the cortisol levels are high and the ACTH levels are normal or high. If these results are seen, then an MRI of the pituitary gland will be done to pinpoint the location of any tumor. Treatment involves surgery to remove the pituitary tumor if possible. Selective adenectomy eradicates the ACTH secreting adenoma and immediately eliminates excess cortisol production while maintaining normal pituitary function. Medical therapy is the standard second-line treatment if surgery is not successful or if it is not possible. Medical therapies include steroidogenesis inhibitors, corticotropic-directed agents, and glucocorticoid receptor blockers. Steroidogenesis inhibitors block one or more steps of adrenal steroidogenesis of cortisol. Corticotropic-directed agents inhibit ACTH production via binding to somatostatin and dopamine receptors expressed by corticotropic adenomas. Glucocorticoid receptor antagonists are used to block the peripheral effects of elevated cortisol, including hyperglycemia. Another treatment option is radiation therapy. Radiation therapy has been used for the treatment with patients with Cushing disease for several decades now. Health problems that may result from Cushing disease include compression fractures of the spine, diabetes, high blood pressure, infections, kidney stones, cardiac and cerebrovascular events, and mood and other psychiatric problems. Untreated Cushing disease has an estimated mortality ratio of 1.9 to 4.8. Cushing disease associated risk factors are reduced with successful treatment. Implementation of the nursing role in ways that reflect integrity, responsibility, and ethical practice. An example of professional identity when it relates to Cushing disease is understanding the physical appearance changes associated with the condition and how it may affect the patient. The nurse should provide support and education to the patient to promote adequate coping.